Back here at home now, taking care of your physical health, now more important than ever, but so is taking care of your mental health.
At a time of social isolation, it can be easy to feel like you're struggling alone. MTN's Annie Johnson has more on mental health care during a pandemic.
When's the last time somebody asked you how you were doing? You probably answered them the normal, "Oh, I'm fine," but have you really stopped and thought about how you're doing mentally?
I have seen an increase in anxiety and depression, low motivation, kind of just struggles to sometimes just get through the day.
This clinical counselor says this pandemic has had an impact on a lot of her clients.
For starters, I think that loss of connection, of seeing people in person and being able to hug our loved ones and just our everyday lives just being kind of turned upside down. I see a lot of people kind of, again, with that low motivation, that it's like, well, what is my purpose right now? Like, what is getting me out of bed? What is motivating me?
There have been mental health concerns regarding catching the virus and social isolation, and now some people have even expressed anxiety with having to wear a face mask.
I could see how it could be anxiety provoking, and there are different skills to use to cope with that and manage it. I mean, I know the other day I was kind of feeling a little bit more anxious than usual going into a store. So I just took a moment before I put on my mask and I just did a deep breath exercise, breathe from the belly and just kind of just slowed everything down before putting my mask on. So again, I can see how it can be anxiety provoking, and there are ways to manage it.
There are several resources available for people who are struggling, including the National Suicide Hotline at 1-800-273-8255. Again, that's 1-800-273-8255. You don't have to struggle alone. Reporting in Bozeman, Annie Johnson, MTN News.
Important to note there, you don't have to struggle alone.
Absolutely true.